Do you have lower back pain? Do you have trouble doing everyday activities? Then this video may be for you.
Welcome back. This is episode 7 on our common injuries series. I'm Andrew Nelson with Running with Dr. Andrew. I'd like to talk to you about low back pain. Hey, back pain is something that is very common with individuals. It can be quite painful, and it's something that you can be treated for and help with. So I'd definitely like to show you guys a few exercises, something to do to help out with your back pain at home. Typically what happens is you'll either have a muscle spasm that causes pain or something having an issue with your disc. And your disc is what that is the cushioning between your vertebrae. And what it does fill up with water. And when you have something called acute disc issue, which acute means you just injured your back and it's very new type of situation. What happens is that disc will start to fill up with a little bit more water and cause a little bit more pain in the morning time. And so that's a normal process. Your disc will fill up with water in the morning, and then as the day goes on, it will decrease in height. And so typically when people have acute issues with their back, they'll have more pain in the morning time because that disc might be a little bit too swollen. So there's a few exercises I can show you. We know this because there's a lot of research done that with the cosmonauts in Russia as well as the astronauts, that their disc will elongate a little bit more because of lack of gravity. And then we know here too that you're taller in the morning compared to the evening time, so definitely that disc will kind of give you a little bit of variation. And typically what happens is when you have acute disc, you'll be painful in bending position. That will cause a lot of pain, bending forward. And sometimes bending backwards might feel a little bit better, or bending backwards could be painful. So this depends on which position. And sometimes some people have more pain in the evening time compared to the morning time. What happens is that disc will dehydrate a little too much. Their cushioning may not be as much as other vertebrae, and so it starts to kind of decompress a little bit more. So you just have more of a dehydration issues. And I'll show you some exercises how to rehydrate that disc there as well. Okay. The first issue sometimes people will have is trigger points. Again, what a trigger point is that it is a tight fiber in your muscle that doesn't release, and that definitely can cause quite a bit of pain, and that can actually give you some pain kind of around this area right here called your PSIS too. So the Gluteus medius muscle here is kind of right here on your side, and it can refer pain right here to your low back area there too, and that sometimes can be another cause of your back pain. So your disc and your muscles are definitely one of them that can cause pain. I'll definitely show you how to do that as well. So when you have a trigger point in your gluteus medius muscle, what happens is they can make that muscle on the side weak, and so that muscle is designed to keep your pelvis even, and when it's weak, what happens is it'll dip down. And so if you're running or jumping or walking or doing squatting, if that dips down, what happens is you're going to put more pressure on one side, and that definitely can cause some of that low back pain here. Kind of show you. So if I'm dipping down a little bit more there too, so we definitely don't want that. Almost kind of like you're walking on the runway, like that. And so we want to be able to be nice and stable whenever you're walking on that. So what happens is when you have a trigger point that shuts that muscle down, and I'm going to show you how to get rid of that trigger point there. Okay, so what you're going to do is you're going to lay down and you're going to find that trigger point right here on that side. It can be quite painful, and you're going to mostly use your thumb if you can. And you're going to find that area there and hold it. And so you're going to hold it and come up and come across. Kind of do some active motion with that. There you go. And that definitely can help out with your trigger points there. Okay, the next thing I like to do, we talked about your disc hydrates and dehydrates. So this exercise is kind of a simple one. So if you have pain in the afternoon with your back, this is one thing that you can do to help out. It's a very simple one. You can use a ball or a clothes basket. And so what you're going to do is, we find with research, if you lay down with your legs propped up just like this for at least 20 to 30 minutes, that's going to help hydrate your disc enough to give you a little bit of cushioning and take some pressure off of your back. And you can just kind of relax here and do this for 2 to 3 times a day if you can. If you have more pain in the afternoon or evening time. Now this exercise is if you have more of the pain in the morning time and it feels better for you to bend backwards. So sometimes people have improved pain bending backwards. And so what you're going to do is you're going to lay down on your stomach. I kind of put your back into extension position there. And you can kind of lay down here just like that. And if that feels okay, you can do this for just a little bit. Then you can raise up on your elbows. And this should feel good. It should not feel painful at all. It should take some pressure off of your low back when you do this here. Hold that for just a few seconds to about a minute or so. And then come back down. You can do several repetitions. And you can do this one throughout the day as well, as long as it makes it feel better during and afterwards. And then you can progress it from going from your elbows to your hands, and more like a phalanx area. And again, it should feel good. Should not cause any pain at all. And again, you can kind of hold it and then come back up again. Come back down. Good. And so also whenever you get up off a mat, you want to make sure, because you have back pain, you don't want to get up like this. That's a big problem with the low back pain. That will cause a lot of back pain. So if you're laying on your stomach, you want to roll over just like this, and when you sit up, you're going to push yourself up nice and gentle like that, because that's going to be very sore whenever you get that low back pain. So the next thing is we're going to build a little bit of strength with your core. And so this is something that you can do to help out. So your core isn't just your abdominal muscles, it's everything, your abdominal muscles and your hip muscles. So this is definitely an important one that you can do here. So you keep your stomach muscles nice and tight and then raise your hips up. Should feel good. Taking some pressure off your lower back. Hold that for just a little bit and come back down. Raise up again. Hold that for a little bit and come back down. So you can do about 10 repetitions, and again, you can do this throughout the day. Now if that bothers you going up like that, you can do another exercise where you bring your knees up towards your chest. Nice and gentle there. That's going to kind of help open up your spine a little bit. Take some pressure off. If that's too much with both, you can do one at a time. And nice and gentle there. And then after you get used to that, you can kind of bring your knees up towards you just a little bit more. And these are just some exercises you can do to help out if it feels better bending forward compared to bending backwards there. So another thing that you can do, you want to definitely roll like a log to come back over. Another one is to doing more like this stretch right here. Again, that helps open up the spine a little bit. Should feel good again. All these exercises are definitely to help with pain. You want to make sure that this is feeling good here. Hold that just for a little bit and then come back up. Come back forward. And then back up. And then one more exercise you can do. So for example, if you have pain on your left side of your back, what you can do, this is kind of a little bit more of aggressive exercise. You just want to be careful with this. Is that you can bring your leg up and then rotate over just a little bit. What that happens is it will help open up the spine a little bit more and also stretch that hip a little bit there too. So I'm actually a little tight on this side here, and that will really help open up that spine and give you a little bit of traction position there. And hold that just for a few seconds and come back over. And again, it should feel good while you're doing it and afterwards there. So, and again, you can do that on the side that's painful. So sometimes people with back pain can have pain on that one side there. Okay, that ends our video with the low back pain. If you have any questions or comments, please comment below. And also what I'll do is I'll throw up the video of our trigger points video that we did. It might have been last week that we did that. That definitely explains a little bit more about where trigger points are and how to treat those areas there. And also don't forget to subscribe and hit that bell so that you don't miss any other videos that we may put out there. And so hope everyone keeps safe out there, keep running, and we'll see you next time.